Welcome, everyone, and thank you so much for joining our well-being webinar called New Year, Well You. I want to start out by welcoming everyone and thanking you for taking the time out of your day to join us today. This new well-being webinar series that we're kicking off here at 2025 here at Excellus BlueCross BlueShield. My name is Jeanette, and I'm part of the well-being team here. I'm going to be the host for today's webinar, and I'm going to be teeing up our guest speaker, Dr. Joseph DePaula, who will be presenting our January topic of New Year, Well You. So first, a few housekeeping items to start off with. Please note that today's webinar is being recorded, and we do plan to get it posted on the Excellus BlueCross BlueShield YouTube page afterward. I also want to call out that your microphones and cameras are disabled for the webinar. And if you have any questions throughout today's webinar, please feel free to put them in the Q&A feature, and then we'll get to the questions at the end. And most importantly, the content today is educational. And if you have any benefit-specific questions or concerns, you can call customer care with that phone number on the back of your health insurance member ID card. So I have the pleasure of introducing our guest speaker today, Dr. DePaula. He is a medical director here at Excellus BlueCross BlueShield, and he has a focus on utilization management. He is a Rochester native, having attended Brighton High School, then went to Colgate University, and graduated from Penn State University College of Medicine. This was followed by a residency in internal medicine with the University of Rochester, and he has practiced medicine for over 30 years. Dr. DePaula is dedicated to improving the health of the Rochester community. He has served on multiple committees and boards, including Common Ground Health, Monroe County Medical Society, and more. He is also a fellow of the American College of Physicians, and we are so happy he is with us today. Thank you so much for being here. I'll turn it over to you.
Thank you very much, Jeanette, and I want to welcome everybody to our kickoff of this program. Thank you for spending time with us. I'm going to go over the agenda real quickly. We'll talk about the benefits of New Year's resolution, talk about healthy habits to consider implementing for the new year, how to build and stick with habits, the importance of preventive health, your role in preventive health, the role of your PCP, talk a little bit about preventive screenings, and we'll talk about some of the benefits included in your plan that will help you achieve the goals that you set. New Year is a great time to reflect and set intentions for the new year with resolutions. A lot of us do it. It provides a feeling of a fresh start and symbolizes a chance to reset. Creates opportunities to redefine personal and professional goals, and creates a motivational boost. It holds you accountable and aids in your overall personal growth and well-being. Today, we're going to focus on healthy habits for the new year, which you can use to guide your resolutions. Preventive health to get you healthier and stay healthy, and ways that we're here to support your health journey this year. We're going to focus on 4 healthy habits or resolutions to improve well-being for the new year: physical activity, healthy eating, stress management techniques, and limiting substance use. You should personalize these goals in a way that works for you. What works for someone else may not work for you. You create your own unique way to incorporate these healthy habits in the new year. I'll be giving some tips as we discuss each one of these. Physical activity is the best thing you can do for your health. It helps build healthy bones and muscles, helps you achieve and maintain a healthy weight. It can reduce anxiety and depression, manage stress. It helps you feel energized, improves your overall health and well-being. There is no medication, dietary supplement, food, or group of foods that will benefit your health more than does physical activity. I can't stress that enough. The good news is that if you're currently not getting regular physical activity, just moving for 5 minutes a couple times a day can start you on the way to realizing tremendous benefits. Walking, bending, doing squats or slow calisthenics can be great. Things like setting a timer every 1 to 2 hours so that you move for a couple of minutes can be a great way to get things started. Any chance you have to move, do it. Some activity is enormously better than none at all. Move your body in ways that you enjoy. Park far from your destination and in the parking lot. And walk during meetings at work if you're able to. Some tips, important to set goals. Set up meetings with friends while you're exercising. Listen to music or a podcast. Do something that's easy and convenient. Lower the barriers. A lot of people don't have time to go to the gym. Some people find that going to the gym very motivating. On the other hand, but lower those barriers. Treat yourself to some new gear. That can be a motivator. Use your FSA or HSA to purchase a fitness tracker, for example, and mix things up. You don't have to do the same thing every day. Make it interesting. Build strength, flexibility, and aerobic capacity. Well, the goal should be at least 30 minutes of moderate activity, 5 to 7 days per week. As I already mentioned, start wherever you are. You don't have to be in pain to benefit. Probably for most of us, the biggest barrier is just carving out a little time. Making it a habit is the biggest challenge. Once you've gotten to 5 minutes, adding minutes to what you're already committed to is a relatively easy hill to climb. Whether you get to the goal of 5 to 7 days per week in 1 month or 6 months won't make a difference in the long term. Again, just start where you are. It helps a lot to track your progress. And Jeanette will talk about resources that Excellus makes available to you to help track your progress. But there are many apps that can do that for you. Good nutrition, as we know, it's essential across life stages, from infant and child growth and brain development, healthy and safer pregnancies, to aging healthy. Eating a healthy diet reduces the risk of chronic diseases, increase your energy level, improves digestion, cognitive function, and even strengthens your immune system.
Dr.
Research
DePola.
shows, yes. Thank you. Yes.
Thank you.
Research shows that fewer than 1 in 10 children and adults, 1 in 10 children gets enough vegetables, and adults don't do much better. Most people in the United States need to increase their daily intake of fiber, calcium, vitamin D, and potassium. In particular, the health benefits of potassium are particularly are underappreciated by most of us. There's excellent evidence that a high potassium diet improves blood pressure. To get started, focus on whole foods and healthy food, and add healthy foods to your diet rather than restricting or eliminating foods that you enjoy. Plan out healthy meals, read labels, and stay hydrated. It starts with shopping. Make the foods that you put into your home are the foods that you're going to eat. So make whole foods readily available in your home. I want to mention especially the benefits of eating mindfully. Slow down when you eat, enjoy what you eat, and give your body a chance to realize that you've eaten. There's all kinds of additional information on the CDC's Healthy Eating Tips page, and that when this video is uploaded to the YouTube channel, there'll be a link to that for you. Stress management. Long-term stress can lead to physical and mental health problems. Managing daily stress can help prevent you from developing long-term stress. Learning to cope in a healthy way can reduce your stress. There are benefits from implementing stress management techniques such as improved sleep, enhanced focus and productivity, improved resilience, builds stronger relationships, improves your physical health as well as the immune system. Some techniques to get you started can be incorporating mindfulness and meditation, prioritizing activities you enjoy, regular exercise, got to keep beating that regular exercise drum, establishing a routine and identifying your stress triggers. Again, in Jeanette's portion towards the end, she'll mention that some of the resources that Excellus makes available to help you manage your stress. Excessive alcohol and substance use can have immediate and long-term health effects. Excessive alcohol and substance use can lead to high blood pressure, heart disease, liver disease, strokes, substance abuse disorders, digestive problems, and a weaker immune system. Limiting alcohol and substance use, improved activity and mental health, enhanced mental clarity, and your energy and self-esteem. Use of alcohol and other substances is a tax on your body and mind. Your brain, liver, and heart, and other muscles divert resources to deal with these toxins. To get started, try limiting caffeine and alcohol consumption. Make sure you take medications only as directed, and share your intentions with friends and families to build a support network. Identify triggers that cause you to perhaps indulge too much, and seek professional help if needed. Some tips on how to build and develop habits. Depending on who you ask, you may get answers that takes anywhere from 3 days to 3 weeks to up to 66 days, and sometimes even longer. Habits are not a one-size-fits-all process, but by applying some of these strategies, you can build and maintain habits over time. Importantly, don't tackle everything at once. We started out the talk with a long list of those four key habits, but choose one. Again, I emphasize the exercise because it provides you with the biggest return on investment. But small steps eventually yield big returns. Set clear goals. Use the SMART goals: specific, measurable, attainable, realistic, and timely. And very importantly, dedicate yourself to a routine. Put it on your calendar. It doesn't have to be the same time every day, but every day do something to make your way on this journey. Track your progress. We'll talk about, I've already mentioned, we'll talk about some tools available to help you track your progress. And give yourself an attaboy or attagirl. Celebrate your successes. I'm going to talk a moment about preventive care. 3 reasons it's so important. Obviously, early detecting a problem before, or even a risk factor before it becomes a disease, is your best bet at staying healthy. Seeing your doctor regularly to have your blood pressure and cholesterol checked, have your weight checked, and discuss approaches to weight control if that's an issue for you. Take control of your health. The more you know about your body, the better you and your doctor can take care of it. If you're nervous about what tests might be, that's perfectly normal. But that's why screenings are so important. If there is something to be concerned about, your doctor is there to answer questions and guide you through your next steps. Let's touch briefly on some of the key preventive health screenings that are available. Excellus relies on the U.S. Preventive Task Force recommendations to determine what is going to be covered. Preventive visits and procedures are covered in full. You should be aware of all of these and take advantage of them. The yearly health visits with your physician will help you stay on track with these. You should be aware that there are occasions when you will incur copay or coinsurance for some of these procedures. For example, if a colonoscopy or a mammogram requires additional studies, sometimes those will incur a cost, as those are considered diagnostic rather than screening. But you should be regularly getting these procedures done. This is really key. As was mentioned at the top, was in practice since about 1990. And before that, I had an extensive experience with my father's practice. And long gone are the days where there was a paternalistic or maternalistic approach to medicine, where patients used to come in and expect to be directed in their care. We're in a better era now, where patients are empowered and enabled to be informed and in charge of their care. I encourage you to take full control of your health care. It starts with asking questions, being prepared with questions beforehand. I used to encourage my patients even to send their questions to me before the office visit. For example, using the patient portal that many physicians have make available to their patients, to submit those questions beforehand to make sure that your agenda is addressed. If the doctor has a different agenda and time runs out, another appointment can be made. But you are the priority. Know your family history. That's really important. Again, things have changed over time. I think generally, as a culture, we're a lot more open to discussing with our family members what illnesses have been in the family, and take notes during your doctor visit. Again, many physicians make available after visit summaries and even the full unedited office notes. Take advantage of looking at those. Ask questions that may arise on reviewing those. At this point, I'm going to turn it over to Jeanette. She'll get into the specifics about those benefits that can help you on your journey.
Thank you, Dr. DePola. That was an excellent overview. I think these benefits that I'm going to touch on really do a nice job of complementing the topics that Dr. DePola talked about. And the first one is a really important one. It's all about how to find a doctor. So you just heard the importance of getting preventive care. But if you don't have a doctor or don't know where to start, you can start right on our website at Excellus BlueCross BlueShield. You can search for doctors, you can search for specialists. Maybe you're looking for an urgent care facility or a particular hospital in our area or nationally as well. You can also filter your results by specialist, by language spoken, whether or not that provider is accepting new patients. It's a very helpful tool when you're looking for a new doctor, whether it's for a primary care visit, to schedule that preventive care, or you're looking for a specialist. Truly, that's a great place to start. The other feature on the website that's comparable or similar in nature is, in terms of being proactive with your healthcare, is we have a cost estimator tool, which means that it can help you budget for expenses. So especially important for those of you who are on a high deductible health plan, you can log in. So you definitely want to log in. That's going to be your best experience on the website. But you can actually estimate for out-of-pocket medical costs based on your year-to-year spending and deductible. You can research different procedures and categories. You can filter by treatments provided and locations. There's lots of features on that tool that you can take advantage of. So our recommendation today is to log in on your Excellus BlueCross BlueShield account. If you do not have an account, we would recommend you register. It will only take you less than 5 minutes. My tip for you, though, with registering is to just make sure you have your health insurance member ID card with you, because you'll need that subscriber ID number when you log in and get registered. So definitely have that be the biggest takeaway from today, is to log into your account or get one started. The next feature that we wanted to mention, which is an additional benefit you have that's included in your health plan, is called member care management and an app called WellFrame. So we have a team here at Excellus BlueCross BlueShield made up of registered nurses, dietitians, behavioral health specialists, and more, all to support your well-being. Anything from little questions to big health challenges, our care managers are here to support you no matter your age, and there's no additional cost. You can call us on the number on the slide, which is 1-877-222-1240, and talk to us about your various medical conditions. Maybe you have a well-being question. But what's also nice is that you can download a free mobile app called WellFrame, and you'll need that access code to get in. The access code's on the bottom right. It's Excellus Welcome, which is all one word, lower caps. But the WellFrame app is a really convenient way to get instant access to that same care manager you might call on the phone. Because within the app, there's a confidential text to chat feature for one-on-one help. Because we know you're all busy, you might not be able to hop on the phone and have a discussion in the middle of your workday, but you can text back and forth with that care manager and get the support that you need. And you will receive guidance, support, a personalized care plan, really just being there to help you manage issues, whether it's a mental health, depression, anxiety, substance use, if it's diabetes, if it's weight loss, smoking cessation. They're here to complement your care and be a part of your care team. They're not here to replace your physicians. They're here to complement your support. You're in the driver's seat, and your care team is made up of your physicians. And if you want, optional care managers here at Excellus BlueCross BlueShield. The next resource we'll review is our digital health and well-being program, and it's called Thrive Well. Now, just a note, not everyone on this call may have access to this benefit. It does depend on your plan, and that was one of the first things we mentioned today, is that some of these benefits may or may not be applicable to you, depending on which plan you have. So you can always check by calling customer care. But Thrive Well is powered by Personify Health. And this is an online well-being platform that you can take and get a lot out of depending on your different well-being goals. Whether you're looking to make small, everyday changes, you're looking to build healthy habits in the areas of physical activity that Dr. DePola mentioned is so important, about healthy eating, improving your sleep, managing your stress. There are tools within this platform that can support and help each of those areas of well-being and more. There's even more on there, but those are certainly the most popular and also they're most impactful. Like Dr. DePola said, taking care of yourself by eating well, moving more is going to do numbers for your well-being, stress management, sleep, etc. We always talk about these same topics with well-being, about eating well and moving more. And you may be someone who's thinking, well, I've already heard that. But the evidence is there. The research tells us that that still is some of the most important things you can do for your well-being, is take care of yourself by eating well, managing your stress, sleeping better, moving more. And then this great resource is called Blue 365. So switching gears a little bit, Thrive Well was an online well-being platform to help you build healthy habits. Whereas Blue 365, this is an online marketplace that you have exclusive access to as an Excellus BlueCross BlueShield member. And you can actually shop for deals and discounts from health and wellness retailers for different deals and services and programs, things like fitness gear, gym memberships. You can search top brands for really some hot deals in categories like fitness, nutrition, apparel, footwear. You can browse anytime. You can log in and check out these deals. You can also ask to get the weekly deal delivered right to your inbox, so you can check out the hot deal of the week. And there's also a popular deal right in the program called Fitness Your Way, and it's a gym membership discount. So you can search by zip code. It's nationwide, and there are lots of gyms that participate in upstate New York, where many of you are likely located. And you can search by zip code and see which gyms participate and see if they offer a discount for joining. That's just one of the features within this great program. So between ThriveWell, Blue 365, member care management, we're hopeful that the various self-service tools that you can take advantage of are now available to you. You know how to get to them, you know how to access them, and we hope that you do take advantage of them. So with wrapping up today's webinar, I'm actually going to turn it back to Dr. DePola for a quick wrap up on some steps to a healthier you this year.
Yeah, thank you, Jeanette. So wrapping up, I'd like to hit some of the highlights here, and that is to really focus on what's going to help you the most. Activity. Start where you are. Start small. Set goals. Make yourself accountable to yourself and sometimes to others. Make sure that you're getting regular evaluations by your physician to help you keep track of those preventive care items that need to be done. And especially, please take advantage of the resources that Jeanette just reviewed with you. I'm a member of Excellus health plan like you are, and I can attest to the value of those resources that she mentioned. With that, we'll take any questions that you have. I guess, Jeanette, are you going to moderate that portion?
Yeah, now's the time. Post your questions right into the Q&A up in the top bar, right in the middle. There's a Q&A feature. You can type your question there. And we'll give everyone a minute or two. While we're waiting for questions to come in, I have a question. What would you say would be a good physical activity tip for those that work at a desk all day?
Sure. I think the best tip I can give is to set a timer to get up. I think a lot of us just get involved in our work, and the time flies. And it's been a particular challenge of mine, even more so, working largely remotely. At least prior to the pandemic, I had the opportunity to get up and walk around and visit my colleagues and coworkers. That's mostly gone now. So the tip is to set a timer, just get up and move, walk up and down the stairs, walk through your home. If the weather permits, walk outside with the dog, if you have one, or two or three like I do. But just to build it in, set a timer.
That's a great suggestion. Thank you. So it looks like we didn't have any questions come through, and it's actually great timing because we're at the top of the hour. So you can click one more through the slide, and we just say thank you so much for joining us today. As a reminder, this will be posted on our YouTube page shortly after. We hope you enjoyed attending, and we hope everyone has a great day. Thank you, Dr. Pola.
Thank you.